We're going to be talking about Medicare today and the way that the Patient Protection and Affordable Care Act cuts into Medicare, destroys Medicare. 2 years ago, the president wanted a health care bill in the worst way, and that's exactly what he got. That's exactly what America got. Anybody that's out there that's on Medicare or about to be on Medicare or young enough that someday you'll be on Medicare should be really concerned about what's happened under this act. All of you, I'm sure, are aware of somebody that is on Medicare that's already been denied a doctor. Denied a doctor because they're not being paid what they ought to be paid. To call it the Patient Protection and Affordable Care Act is a major, major mistake. It neither protects Medicare patients nor makes it more affordable. In fact, one of the things we'll bring out today is that there's been a theft of $500 billion from Medicare to fund other parts of the program. There's some fraud in it because it was spent, but it still shows up in the account. That's how they show that this really doesn't add to the debt. And to solve the whole thing, they've got a whole new board of unelected bureaucrats to make additional cuts to Medicare to make it look like it's okay. And then there's the accounting sleight of hand. I'm one of the two accountants in the United States Senate now, and you got to pay attention to see it. But it goes back to the fraud, because if this same sort of thing were being done in the private sector, people would go to jail. And there are a number of ways that we'll bring out how that is not just budget gimmicks and not just sleight of hand, but actually taking advantage of seniors. The chief Medicare actuary said that Medicare will go broke in 2024. That's 5 years earlier than last year's report by the chief Medicare actuary. That's the guy that works for Medicare. He doesn't work for us. And he has to figure out each year how much in the hole it is and what needs to be done to fix it. And my contention, of course, is that you can't steal $500 billion out of a program that's already going broke and expect it to be fine. And we warned about that as we were going through the passage of this Patient Protection and Affordable Care Act, which, as everybody has mentioned, was passed 2 years ago tomorrow. It could have been fixed. There were 3 plans on the Republican side that would have done what is claimed to be done by this act. Those ideas were largely rejected. There were a few places that they fit in the same as what was in there, but were largely rejected. So today we're going to talk a little bit about some theft, some fraud, some unelected bureaucrats, and some accounting sleight of hand. And I have some people here that want to respond to some of the things that have been said. I think Senator Coburn listened to some of the previous comments that were made on the other side celebrating this great day.